Do you frequently feel like your heart pains sometimes? Or maybe you're often tired even after a full night's sleep? What if I told you these signs might not just be from stress, but could point to something deeper, like a blood problem? Meet chronic lymphocytic leukemia, or CLL. It's a type of cancer that starts in the white blood cells called lymphocytes, your infection fighters. In CLL, your body makes too many of these cells, but they don't work well. They pile up in your blood, bone marrow, and organs like your spleen or lymph nodes. Imagine a factory making too many broken phones. They take up space, but don't help. That's what happens in CLL. And the scariest part, many people don't feel sick at first. It's often found during a routine blood test. So if your doctor says your white blood cells are high, don't just brush it off, ask why. So what causes CLL? That's a great question, and honestly, doctors don't know the exact cause. But here's what they do know. It starts with a mistake in the DNA of a single white blood cell. That cell starts multiplying like a broken copy machine, making millions of weak clones. It's like one typo in a computer code that makes the whole system repeat endlessly. Now, is it from something you ate? A virus? Probably not. But certain things raise your risk. Are you over 60? Your risk goes up. Male? Slightly higher chance. Family history of blood cancer? That matters too. But it's not contagious. No, you can't catch it from someone hugging you or sharing a drink. And no, using a cell phone 24/7 doesn't cause it, despite what rumors say. Think of it like bad luck in your genes, not poor choices. Let's play doctor for a second. Imagine you're feeling tired all the time, even walking to the mailbox drains you. Maybe you've lost weight without trying, like your body's burning fuel nonstop. Do you have lumps in your neck, underarm, or groin? Those are swollen lymph nodes, a clue your immune system is overworking. Or maybe your belly feels full quickly when eating. That could mean your spleen is swollen from too many bad cells. Fevers that come and go with no infection. Night sweats that soak your pajamas. These are all red flags. But, and this is important, some people feel perfectly fine. That's why CLL is sometimes called a silent cancer. So ask yourself, has your energy dropped lately? Are your routine blood tests showing high lymphocytes? If yes, talk to your doctor. Don't wait for pain to take charge. First, they check your blood. A simple CBC, complete blood count, can show too many lymphocytes. Think of it like a traffic report for your blood. Too many cars, cells on the road. If that's abnormal, they'll do a flow cytometry test to confirm these are CLL cells. They might also look at your bone marrow, a small sample taken from your hip, to see how crowded it is. Scans like CT scans check if organs are swollen. Now, treatment. Here's the kicker. If you feel fine and your counts are stable, you might not need treatment at all. This is called watch and wait. It's like monitoring a storm on radar before it hits. But when it's time to act, doctors use targeted drugs like ibrutinib or venetoclax, pills that block signals telling cancer cells to grow. Sometimes chemo is used, but less now. Immunotherapy helps your body spot and kill bad cells. And yes, you can live a long life with CLL, especially when caught early and managed well. Can you prevent CLL? That's the million-dollar question. Right now, there's no sure way to prevent it because we don't know the exact cause. No vaccine, no diet, no exercise plan that guarantees you'll avoid it. But that doesn't mean you're powerless. You can't stop the genetic hand you're dealt, but you can play it smart. Keep up with regular checkups, especially if you're over 50 or have a family history. Blood tests don't lie. Don't ignore symptoms like fatigue, lumps, or night sweats. Quit smoking, always a good idea, though not directly linked. It lowers overall cancer risk. Stay healthy, eat well, move daily, manage stress. Your body is more resilient when it's supported. So, can you prevent CLL? Not 100%, but you can arm yourself with awareness and early detection. What's new in CLL? Great question, and the news is hopeful. Scientists are making big progress. Remember those targeted drugs like ibrutinib. Now we have newer ones like pirtobrutinib, which works even when older drugs stop working. It's like upgrading your antivirus software when hackers find a loophole. There's also exciting research in CAR T-cell therapy, where doctors take your own immune cells, supercharge them in a lab, and send them back to hunt cancer. Early results show long remissions in tough cases. What's more, combinations of drugs, like venetoclax plus anti-CD20 antibodies, are helping people go years without needing more treatment. And minimal residual disease, or MRD, testing, basically, checking if any cancer cells are left, guides treatment decisions better than ever. So if someone you love has CLL today, the future looks brighter than ever. Science is fighting hard,